Today I have my friend Anastasia joining us, and she is from Maryland. Is that correct? Maryland?
Yes.
Awesome, awesome. And can you tell us about your practice, Miss Anna?
Yeah, so I am fully telehealth based out of Maryland, and I specialize in men's testosterone replacement therapy, specifically men. I get questions about women all the time, but right now, focusing specifically on men's hormone replacement therapy and optimization, because there's a difference between replacement, just replacement, and then
Sure.
really optimizing. So It's we're fully telehealth in 8 states currently and expanding, which is very exciting.
Right on. Good for you. Congrats, congrats.
Thank
So
you.
why men? What is the draw? What do you enjoy about treating men and men's health and the hormone optimization side of things versus other areas of medicine?
Well, as I was telling you earlier, started off with weight loss. So when I first started out, I was treating just weight loss management, helping people reach their goal weight using peptides and things like that. And the more I started learning about testosterone replacement specifically and the men that were coming in, everything was just pointing to low testosterone. And so as I saw the big impact that testosterone replacement therapy had on men's
Sure.
lives versus just losing weight or reaching a goal weight, which can sometimes be temporary, unless you really fix the underlying issue. So you know, sometimes you go to a provider, you get your symptoms looked at, you get them treated, and it's a temporary fix. Testosterone replacement therapy changes lives. And, I'm here to do that. I'm here to help along the way for that.
Right on, right on. So you said testosterone optimization versus testosterone replacement. How would you define or delineate what separates the two?
So, in my opinion, what separates the two is testosterone replacement therapy, just general, you go to a provider, they'll give you gel, they'll give you some cookie cutter dose that everyone gets. And this is just replacement. You're going to get your levels up a little bit. Are you going to get truly optimized? Optimized meaning you really have symptom resolution from low testosterone and you're physiologically supported where you can then make lifestyle changes with a solid foundation. And that's what optimization does. It gives you a solid foundation. There's no 1 month you feel good, 1 week you feel good, so it really is testosterone replacement therapy, in my opinion, is just, here, let's see what happens. And optimization is truly getting your levels to where you have symptom resolution, even if those levels aren't, you know, the accepted 600, let's say.
Sure. What would you say the archetype of what a conventional low T patient might appear in your practice? What are some characteristics about them?
That's a good question because a lot of people think the guy that seeks out testosterone optimization is lazy, doesn't want to put in the work, doesn't want to go to the gym, just eats junk food, sits around on the couch. And there are guys like that because low testosterone can really impact motivation, it can impact
Sure.
confidence, it can impact your endurance, your ability to get up and go. But for the most part, the guys that show up are already doing all these things. They're already running businesses. They're already going to the gym. They're already in extracurricular activities. And then they come in and they're like, I just don't feel like myself.
Want to get blood work done but hate going to the doctor? Then skip the office visit and go to buylabwork.com. Use promo code BYLabWork10 for 10% off any order over $100.
I don't feel like going out to do these hobbies that they liked before, boating, golfing. They're just like, I'd rather sit on the couch. They're going to the gym, they're sustaining injuries, and they're not even working out that hard. Or they're working out and just not getting the same results as before. Whereas before they were, years ago, working out with progress. Now they're like, I feel like I've declined in my workouts.
Sure.
So for the most part, the guy that comes in and actually seeks out testosterone replacement therapy or testosterone optimization is a guy that's already doing all the things, but knows that something is off.
Gotcha. So it's honestly, you're getting guys that are actually already pretty well established, high achieving type guy.
Yeah, that's what people typically, they think, oh, if you get on testosterone replacement therapy, you must not work hard enough. Oh no,
Sure.
these guys put the work in, for the most part. Of course, there are guys that come in that, have been overweight for several years that, at this point have already been prescribed an antidepressant, have already been
Oh yeah.
prescribed, ED medication, basically just covering up symptoms that could be potentially corrected with correcting hormones, which again affects your physiology.
What are some methods of testosterone replacement that you do? Or what do you
So I
find that a lot of guys like?
so I primarily focus on testosterone injections.
Sure,
Again, I'm
sure.
fully telehealth, so we're not going to be doing pellets, which by the way, I'm not a big fan of those
I think they
anyway. Just
suck.
yeah. So
But this,
uh
yeah, that's just my thoughts. So
But, you know, we do or I do testosterone injections. Typically we'll use testosterone cypionate or testosterone enanthate. Um, and we do what works for the guy.
yeah, yeah, yeah,
Some guys do twice weekly injections, some guys do everyday injections,
yeah,
some guys do intramuscular injections, some guys do sub-Q injections, and I always tell my guys, they come in and they're like, I read you should do this, or I read this is the best way, and I'm like, forget about what the other guy is doing.
yeah,
They'll
yeah,
come in and they'll be like, oh well, I heard that daily injections is the way to go. Meanwhile, they're busy. They've got a full schedule. On top of that, now you have to remember to do something every single day, to do
sure.
this injection every single day, you know. So I try to work with them as best as possible for what works for them.
Yeah,
At the end of the day, testosterone replacement therapy is a long-term treatment. You got to do what works for you and you got to do what's sustainable.
sure.
If injecting once a day is sustainable for you and it works, great. But if it doesn't, we can work around that. So I try to allow them to have as much say in their treatment as possible, as long as it's clinically safe.
Sure, sure, sure. So, what would a workup, like a new patient workup, look like if someone were to work with you? Blood work and the consultation type process. How would that
Yeah,
proceed?
so that's a good question because a lot of people are like, can we just chat a consultation? And I'm like, a chat and a consultation isn't going to give us the full picture on whether or
Sure.
not you're someone that could benefit from testosterone replacement therapy or not. So what we'll do is we will do a medical evaluation visit. This is our initial visit. We meet, we go over your medical history, we talk about your symptoms, we dive deep into your symptoms. We make sure that there really isn't any, possibly blaring contraindications. We'll see what medications you're taking, and we'll order a set of labs. And then, typically from that first visit, I can suspect if someone would benefit from testosterone replacement
Hmm.
therapy or not. But getting baseline labs is absolutely important. So that's usually the first visit. And then once the labs come back, we get on another call, we review the labs, and we see, do the labs reflect the symptoms that you described? And if they do, we can discuss moving forward with testosterone replacement therapy. So there has to be a foundation. We have to know if this is a good fit for you, if you are someone that could even benefit from this type of therapy.
Because there's so many clinics out there. How do you really set yourself apart?
So as far as blood work, I'll have guys that transfer over and I'm like, send me your initial lab work. And every time it's either incomplete, in my opinion, okay,
Uh,
SHBG is missing,
sure. Oh yeah.
okay,
Oh yeah.
LH is missing on the initial labs, okay,
Sure.
or it's so extensive that I'm just like, why would you even want to know all of this? This is too much, So the blood work that I look at, obviously we evaluate hormone levels. We look at total testosterone. which is important. We look at the SHBG to determine the free testosterone. We'll look at luteinizing hormone.
Hmm.
I like to look at the lipid panel. I just like to track things, get baseline labs for that, CBC, CMP. Really, the initial lab panel is to see what's going on with your hormone right before you start testosterone replacement therapy and to track progress. And then additionally, depending on how the patient presents, depending on the problems the guy's having, is he significantly overweight? We'll run an A1C. So I'm not primary care, but I like to track things.
Yeah,
And
yeah.
a lot of these guys that come in, they either don't like going in to a doctor's office, they haven't gone in years, or they just don't have a primary care provider. I always say, you got to establish primary care, manage
Hmm.
your chronic conditions. But if a guy comes in and I can see that something should be checked, something that we can correct and monitor, I'll run those labs too. But baseline labs, total T, SHBG, LH, things like that to get a baseline of what's going on with the hormones.
Do you find any utility in tracking guys' estradiol levels? Because I know that's something a lot of guys historically always blame every symptom, every problem on. They blame it on that.
Of course.
Is that something you follow a lot?
So, as far as estrogen, depending on what lab I'm using to order the lab, sometimes it's part of the panel. I don't care. Whatever. Estradiol shows up on the labs. Great. We see what it is. We don't really, give too much
Sure.
thought about it. So, as we know, estrogen is made from testosterone. Okay.
Yeah.
It's aromatized. Testosterone aromatizes into estrogen. It's the downstream hormone. And so naturally, this is something that happens. There's a lot of benefits to estrogen. And what a lot of guys don't understand is you can't really expect your testosterone to go from 200 to 1100 and the estrogen not move. It's going to increase. You
I know.
have more testosterone. So that's one thing. Testosterone is going to increase in some men more than others. That's okay. The misconception about estrogen is that the serum value on labs tells you everything you need to know about estrogen. And if it's high, you must have high estrogen symptoms and you're going to have man boobs. And so you want to get it as low as possible because it's a woman's hormone. The serum estrogen value basically spill over. A tiny percentage of that estrogen is actually going to travel anywhere and exert its effects. Okay. So the rest of it is going to get excreted. So when guys are like, what's my estrogen value? I need an estrogen blocker. I was told, they're coming in from somewhere else. I was told that I need to take an estrogen blocker because my estradiol was 60 on labs. What are you really trying to manipulate? Serum values? That's going to get excreted anyway. So yeah, I see estrogen on labs. We don't really monitor estrogen as much as other places.
Emerging literature shows is that it's clinically insignificant. I mean, it doesn't really mean a whole lot.
That, but also again, you got to consider the downstream hormone. Are we
Hmm.
monitoring DHT? You know, are we, it's a downstream hormone. It's a natural process for testosterone to convert into estrogen. Blocking it, and a lot of guys don't even realize that an anastrozole is a cancer medication. Most of these guys, want to optimize, they want to take supplements, they want to be natural, they want a cold plunge, and then they'll take a cancer drug to
Yeah.
block the natural downstream hormone of testosterone. It's just, I think that when I was in nursing school, I had a professor say that if you go into a hospital, she was like, when you guys graduate and you go and you work in the hospital and you're going to be really excited to be in the environment and work with, other people that have a lot of experience. One of the main things you want to look out for is any unit, any provider, and any nurse that says anything like, we do this because this is how we've always been doing it.
Ah, the old
Okay.
mantra.
Yeah. So just because, you know, traditionally testosterone was you had to use a 1.5-inch needle right in the glute. You had to block
It's like
estrogen.
a
Estrogen is
punch
bad.
biopsy.
Just because things were done that way doesn't mean, for a long time, doesn't mean that it's the correct way. So, yeah, the way I do things is a little bit more leading edge. But you know what? It's 2025. We're learning new things. More is being revealed. The way things were done in the 90s is not how things are being done today.
Sure.
That's okay. That's progress. You can't expect, how you approach certain things in medicine to stay exactly the same.
Sure. I mean, you want to work with clinicians who stay more up to date, stay more modern, stay more
Yes.
progressive. If not blocking estrogen, then what would be some of the benefits of not blocking estrogen? Since guys tend to think it's such an evil hormone.
Yeah. So, first of all, estrogen is part of when guys say, well, there's many factors to this, but one of the things that guys say early on in treatment is I feel like I just have more mental clarity. I feel like I
Ah,
can think more clear and I feel like a mental fog has lifted. This is one of the benefits of estrogen. Libido. Estrogen plays a role in libido. Long-term health. Estrogen plays a role in your cardiac health, and down the road, it helps with bone integrity. So, the worst thing that can happen, or one of the worst things that can happen to an aging guy, is falling and breaking a hip.
sure,
Recovering
sure.
from that, there's a difference between recovering from that when you're 20 and recovering from that when you're 55. There's a big difference. So, one of the long term benefits is increased bone density of estrogen. Imagine you blocking that positive effect because someone told you you're going to grow man boobs unless you don't block estrogen. Which, by the way, the hormonal environment that needs to take place for gynecomastia to occur or for man boobs to happen is not an environment that's going to happen on testosterone replacement therapy unless the protocol is just complete trash.
Sure, sure. I mean,
So it's not,
honestly, you never see it.
there's a lot of education that needs to happen. One of the things that, during the visits that I do with guys is we have extensive education so that they understand what's going on.
Yeah,
Oftentimes you'll hear, guys I'm on testosterone, I'm on HCG, I'm on Clomid, I'm on these three peptides. And I'm like, what were you put on all of that for? Straight out the gate from their first visit. Oh, I don't know. They said it was good. Well, you got to know what you're taking and why. So we do a lot of education and we make sure that there's a reason for you to take something, not just because it's good for you.
speaking of peptides, is that something that y'all have any experience with?
We do offer peptide therapy. Again, primarily we focus on testosterone optimization.
Sure, sure.
Peptides isn't the forefront, but holistic care and again, testosterone optimization can include peptides. Let's say, I'll give you an example. I got an email this morning. One of my guys is like, look, I was working out, I was training, I sustained an injury. Can we talk about some healing peptides? Of course. You can always use peptides. Same approach as, let's say he would have called his primary care. Hey, I sustained an injury. Okay, here's prednisone 50 milligrams 5 days a week to reduce that inflammation. Peptide therapy, some peptides work even after you stop taking them. They promote recovery versus, again, just treating a symptom. So, yeah, we do offer peptide therapy. It's not something that's in the forefront, but if a guy presents with something that a peptide could help with, we definitely talk about it.
So
Sure,
it sounds like
sure. So something
testosterone is definitely y'all's back. That's your foundation for sure. You build around the
Yeah,
testosterone.
definitely. It's life changing. I mean, you see
Oh
the
yeah,
difference between when a guy comes in and then, 6 months, 9 months, a year, 2 years down the road. It's like sometimes they're just completely different people in a very positive way.
absolutely. And you were saying earlier, one of the big things you see of these guys is the mental clarity. It feels like a veil has been unlifted. I mean, I've been on TRTs 10, almost 10 years now, and I'll say that's the first thing I noticed. In my opinion, that was the biggest benefit was the mental clarity.
Oh my gosh, yes. And that's a good point that you bring that up. So a lot of times, guys will come in on stimulants, they'll come in on SSRIs and into their treatment, into their testosterone optimization, once they optimize, once the low T symptoms have been resolved, a lot of those guys end up not needing those stimulants or those anxiety or depression medications, or really lowering their dose. So, and this is another thing that I wanted to mention since we were talking about estrogen. One of the misconceptions is I get on testosterone replacement therapy, and now, I'm scrolling TikTok and I see this really touching video and I start crying. And so it
Yeah.
must be my estrogen. When really, low testosterone can make you feel flat. It can make you feel uninterested, unmotivated. It can make you feel sad and grumpy. So
Hmm.
you're going to be scrolling, you see a really touching video, you're going to be like, okay, this is pissing me off, and move on. But you optimize on testosterone replacement therapy, now you're feeling a vast, more human emotions, and you're having an appropriate human reaction from
Yeah.
watching a touching video. Kittens are cute, and somebody, reuniting after years of not being together in a video is touching. It's
I think that's
appropriate.
wonderful.
Yes, it's appropriate to tear up a little bit. And some guys, they're afraid of that. They're not used to that. They're like, what's wrong with me? I'm feeling, that's okay. It's part of being human. You're feeling, you're responding appropriately to a touching video that was probably meant to make you cry or tear up anyway.
Yeah.
So sometimes they'll notice a change and they're like, oh, it must be estrogen. No, it's just you're not blunted anymore. You're not flat. You're
Sure.
actually feeling some human emotions.
Dude, you're normal. You're supposed to experience that.
Yeah, you're supposed to watch a touching video. It's nice, being a female, I cry. I'll cry. I'll watch a touching video and I'll cry. And it's good. It's cathartic. It's a release. Guys could
Yeah.
take some notes from us females as far as emotions and allowing yourself to feel.
No, I've had that conversation plenty of times. I've had one guy demand estrogen blockers because he said he cried at his daughter's wedding. I'm like, dude, I'm happy for. I want to cry for you. You should be grateful. You should be so celebratory. That's a wonderful milestone as a parent to see that.
So yeah, mental clarity, you know, being present with your emotions, feeling emotions, it's okay. And it does come with testosterone replacement therapy and some guys more than others. But yeah, the mental clarity is definitely one of those first psychological improvements that happen as guys start to optimize. The mental clarity, the feeling a little bit more confident, the just overall sense of well-being. And another thing that is very noticeable um, in men is they just have a bigger capacity to deal with the BS.
Ah,
Before it's like, my kids are pissing me off. On an initial visit, classic initial visit
yeah,
is, I love my wife and I love my kids, but sometimes I just yell and I feel so bad and then I have to apologize. Classic low
yeah.
testosterone feeling
Oh,
grumpy. Yeah,
yeah,
it's on the Adam questionnaire. It
yeah.
says, "Are you grumpy?" You know? So it is a low T symptom, but yeah, as guys optimize, one of the things that they can experience and look forward to, and it varies by the individual, is just having a bigger capacity to deal with stress. You don't feel like you're snapping, your kids are running around, your phone's ringing. It's okay. You got it. Life is happening and you're all right.
Do they ever come to you thinking that they have to like donate blood, have to do all this other bullshit that they read about or get, targeted ads for? Are there other myths or things like that you have to dispel with them? we're
Yeah,
talking about.
yeah, the donating blood, worried that your blood is going to get too thick, all of that. Again, this is another thing that we heavily educate on. We talk about that testosterone does stimulate red blood cell production.
Sure.
Back to the mental clarity. Remember how I said estradiol is responsible for some of that? And so are other things. Increase in red blood cell production. Red blood cells carry oxygen. More red blood cells, more oxygen to the brain and everywhere else. A little bit more mental clarity, feeling a little bit more awake. So an increase in red blood cells isn't necessarily a bad thing. Now, I'm kind of in the middle when it comes to blood donation. I
Sure.
am
Sure.
definitely not, you've got to donate routinely. You know, your hematocrit is 54. I'm not going to send you out to therapeutic phlebotomy or do a blood donation. At the same time, I'm also not going to tell guys not to donate if that's what they want to
Sure.
do and their red blood cells, hemoglobin, hematocrit is elevated. First of all, there are guys that donate outside of needing to because they're on TRT. There are guys just,
Yeah.
that donate because they got O negative blood and they're like, Red Cross loves me. So I
Yeah.
go,
Sure.
you
Help
know,
them out.
right. Additionally, yes, if a guy comes in, he's got, elevated red blood cells, hemoglobin, hematocrit, elevated to where it would be concerning for me. And we've ruled out any other causes. Are you smoking? Are you wearing your CPAP consistently? We've ruled out all these other things. Yeah, we can do therapeutic phlebotomy, and a lot of it does come down to legal issues. If anything were
Sure.
to ever happen, unfortunately, it's never going to be pointed at the other specialists they see or the other medications they take or anything else. As soon as anyone hears they're on testosterone, unfortunately, everything gets
Yeah.
blamed on testosterone, so
Sure. Sure.
we do educate on you know the increase in red blood cells. We also talk about the transient nature and the snapshot of what hematocrit actually is. A guy can come in and his hematocrit is, let's say, 55. He can go back that evening after hydrating well, and it can be different. So, again, we're not looking at just one number. We're seeing what else are you doing?
Yeah.
How much are you drinking? How much did you drink before the draw? Things like that. Hematocrit is an increase in hematocrit doesn't mean you need to run out and donate blood and do therapeutic phlebotomy. An increase in hematocrit means you need to assess what's going on. What information is it telling us? Is it telling us about your hydration status? Is it telling us about something else? We need to assess. I explained to them, even the guys that want to donate just because for, other reasons outside of TRT, is that it can cause a vicious cycle. And the vicious cycle is it's going to lead to red blood cell spikes. And then you're going to need or think you need to go donate again. And here's another misconception. So a lot of people think, let's say you come in, let's say, a guy comes in, he's got elevated red blood cells, hemoglobin, and hematocrit. He's 3 months into TRT, and he's like, I got to go donate, from whatever he heard. Let's just say nothing changes. We don't assess what's going on with, we don't modify the protocol, possibly dose adjustment, possibly injection frequency adjustment, possibly injection site and route adjustment, which all of those things can affect your blood work and your experience on TRT. But let's just say none of that was ever modified. And you continue doing whatever you're doing. The red blood cells, hemoglobin, and hematocrit aren't indefinitely going to rise. Eventually, they will stabilize and even possibly decrease, because there has been times, a guy comes in, you know, elevated red blood cells, hemoglobin, and hematocrit, even to a point where I'm like, we should do a therapeutic phlebotomy. Again, this is a once in a while occurrence. Like I said, I'm not someone that says you should do it routinely, but sometimes it's appropriate. I'll give them the therapeutic phlebotomy order. They'll come back in 3 months. I'm like, oh, your blood looks great. Did you do your order? Nope, never did it.
Oh,
And so that's what I mean. They don't indefinitely rise. They will stabilize. Again, it depends on hydration status heavily. So yeah, the whole you got to donate right away, it's counterproductive because then you're stuck donating. It's a temporary fix. Like I said, if they never went, it could absolutely, you know, level out and even decrease. I've seen, you know, red blood cells, hemoglobin, hematocrit decrease without them ever doing anything. So, you know, you got to take the labs with a grain of salt a little bit. You really have to look at the whole person. So that's very important.
what influence would the SHBG, for anyone that doesn't know, what influence would that have in terms of how it could possibly direct their care?
Before we talk about SHBG, let's talk about total testosterone.
Sure.
Okay. And then we'll come back to the SHBG. So,
Yeah.
a lot of people get their total testosterone checked. They're like, oh, you know, it's 430. My total testosterone is 430. I'm in the range. It looks good.
Yeah,
Everything is
in the
fine.
range.
Perfect. In the bottom of the barrel, but in the range. So you're in the range. Okay. What is that? Let's just, for simplicity's sake, let's just say 500. Okay. Your total testosterone came back 500. What does that actually mean? What is the total testosterone made up of? Well, it's made up of free testosterone, which is testosterone that is actually floating around and can go into receptors, it can go into the cells, it can exert its effects. And it's also made up of bound testosterone, and it's bound to a protein. And that protein is SHBG, or sex hormone binding globulin. And the sex hormone, in guys' case, is testosterone. So when testosterone is bound to the SHBG, it's a big, bulky protein. And now the testosterone can't get onto the receptors, can't get into the cells, can't exert its effects. So you've got your regular testosterone floating around, it's free, it's doing what it needs to do. And then you've got a bound testosterone, bound to SHBG. Now it's got this big bulky protein on it. It can't get onto the receptors. It can't exert its effects. So we look at SHBG to determine your free testosterone, because if you're someone that has a total of 500, let's take two guys, both of them have a total of 500 testosterone, and one of them has an SHBG of 40, and one of them has an SHBG of 18, their free testosterone, their available testosterone, is going to be different. And why is free testosterone important? Free testosterone is important is because that is where most of the symptom resolution is going to come from. A guy with a total of 500 and a free testosterone of 7 is going to feel like crap. So, to answer your question, why are we looking at SHBG? Well, we need to know how much binding protein there is. We need to determine what your free testosterone is. And as you know, once you add androgen into the body, it will reduce some of that SHBG and free up some of that testosterone, which is part of what leads to symptom resolution. With that being said, you know, there is a range. One of the things that people ask is, what's a good range for SHBG? A good range, 20 to 30, you know, 20 to 35, that's a good range. And, you know, obviously you don't, one of the misconceptions is, well, if SHBG binds to testosterone and we can't use the testosterone that's bound, well, let's just completely reduce the SHBG as much as possible. You know, you don't want that to happen either, because SHBG is useful. It works like a buffer. It allows testosterone to be used and not used when it doesn't need to be used. When SHBG is super low, there's a lot of free free testosterone going around. A lot of it is being metabolized very quickly. And sometimes, even when you have a great total testosterone and the SHBG is too low, it can still cause hormonal variations throughout the week, which one of the reasons why a guy gets on TRT is to have stable hormonal environment. But back to the SHBG and about not chasing labs. So let's say a guy ends up having, an SHBG of 15 or 14, okay? And if the range that I would prefer to see it in is about 20 to 30, 20 to 35, the guy feels good, his total looks good, his free looks good, he has symptom resolution, he feels optimized. I'm leaving that 15 SHBG. I'm not
Sure.
making him make a bunch of changes, change up his whole protocol, micro dose every day just to try to raise that SHBG. We're leaving it. I'm not going to make you, change up your whole routine just to chase that number on labs if you feel good.
So it sounds like most of the care is directed towards just how they feel, the improvement overall, at least symptomatically. That's the term you keep using, is symptomatic resolution, symptomatic improvement. Would you say
Absolutely.
that's the goal for most
That is
people?
absolutely the goal. Yeah. You come in, you got all these symptoms of low testosterone that are significant enough for you to reach out to a professional to try to correct that. You're tired, you're not as motivated as before, you've got more spontaneous morning erections once a month. As a man, that can't feel
That's
good.
terrible. That's
I couldn't
terrible.
imagine. So you're having issues, um, you're losing erections, you're overweight, you come in for treatment, and the goal of treatment is symptom resolution and for you to get a better baseline. So you come in and you're right here. Once you're optimized, your new baseline should be up here. And that is your new baseline. You have symptom resolution, you're motivated, you're confident, you're standing up straight, your posture looks good, you're working out, you have the endurance, you have the strength, your morning erections have returned, your wife loves it, the other aspects,
Sure.
okay?
Absolutely.
You're able to lose weight more easily and put on muscle more easily. You're dialed in, you're optimized. That is, your new baseline. Once you're there, you know, everything else is what you do, your lifestyle. You want to, improve in this additional aspect, do it. You're foundationally solid, you're stable, your hormones are supporting you versus putting you at a detriment, which is what it was while someone had low testosterone.
One last question. For any potential new clients, what kind of time frame would you anticipate for, let's say, 70% improvement?
Here's what I'll say it takes about 6 months to a year to get dialed in and optimized. Okay. As far as symptom resolution, it can take up to 3 months to start moving in that direction. And this is a conversation that I have with my guys, and it's important because a lot of times you hear, oh, I started on testosterone 2 weeks ago and I feel amazing, But the reality is, it can take up to 3 months to begin to move into symptom resolution. Okay, psychological improvements first, followed by physical improvements. Do guys get on testosterone replacement therapy and start feeling better earlier? Absolutely. Do some guys do their first injection and they're like, this week I feel amazing? Absolutely. But I always explain that it takes about 3 months to move into symptom resolution, because if you're a guy that started on TRT and you're like 5 weeks in and you're like, I don't really feel any different, that's okay. And I wouldn't want anyone to get discouraged because you're comparing yourself to what you're hearing on the internet or the experience that your friend had. Don't worry about what and how the other guy is doing it. Your experience is going to be your experience. So, I just always let them know about 3 months to start moving into symptom resolution. And as far as, feeling 70% better or beyond from low testosterone symptoms, yes, it can take about 6 months to a year. That's okay. It's a dialing in process. We see each other, we look at labs, we talk about how you're feeling, we see where we can make improvements, we possibly adjust dose or injection frequency. We talk about other factors. That's why it's called dialing in. It's not on off button. It's dialing in. So we make adjustments until again about 6, 9 months in, they're on a good dose, a good injection frequency, feeling good, feeling comfortable with their protocol, able to show up in their life at a different capacity than they were before TRT. And then, we can see each other a lot less often and go live your life optimized.
That sounds good. 6 to 12 months. Honestly, that doesn't really, in my opinion, that sounds like a very fair, quick evaluation. Especially if you've been feeling like shit for 10 years. What's 6 months? That's just kind of how I look
Absolutely.
at it.
Absolutely. Yeah. Yeah. It's definitely not an overnight thing. With that being said, back to it takes about 3 months to start moving into symptom resolution. By the way, what does that mean? Moving into symptom resolution. This looks like you've been on testosterone replacement therapy for 3 months. You're now having your follow up visit. I would expect for you to say, yeah, I feel a lot better. I just feel I feel better, and then we'll dig more into the specifics, but versus expecting to come back in 3 months and, oh my gosh, I'm totally optimized. I feel absolutely amazing, which by the way happens. It happens. There are guys that will start on TRT and, they'll message a few weeks in and they're like, I, feel a lot better. So that's always good to hear the report back.
Awesome. Well, how can people get a hold of you? What states, what areas are you servicing? What are some ways people can contact you or reach out to you?
For sure. So we are in 8 states right now. Let's see if I remember off the top of my head. Maryland, Delaware, West Virginia, Arizona, Colorado, Iowa, and Nevada. And then we've got a few more states in the works. So if you didn't hear your state, definitely check back in soon. Um, TikTok, Invite Wellness, Instagram, Invite Wellness, and invitewellnesstrt.com on the website. Yeah, you can reach out there. And, if you're not in a state that I treat in, follow the TikTok, follow the Instagram. There's so much information,
Oh yeah,
uh, so you'll learn something along the way. And when you do go to a clinic, hopefully you can take that information and you can kind of filter out like, hey, I know I'm not supposed to be taking an estrogen blocker.
sure.
So
Yeah,
you
you put
can
a lot of
filter
great
out those
content out there.
things.
You have a lot of wonderful
Yeah, yeah.
content. Very educational stuff. Then what we'll do, we'll post it like right up here doop, for our editing team. They like when I do that. Uh, and we'll be sure to share it all. Any advice? Any last shout outs or anything?
Yeah, my advice is don't wait too long because, this whole thing of guys are like, oh, I don't know, maybe I'll wait a little bit or I'll put it off. Time flies. You're not getting any
Oh,
younger. You're 45. You're going to be 65 before you know it. You put something off for a little bit, you look back, and a year, 2 years has passed. Your health is the foundation of how you show up in life. You can be the richest man in the world, and if you don't have your health, what is the quality of your life? So my suggestion to guys is get evaluated, correct your hormones, and not only will your health, but the quality of your life, how you show up in your relationships, in your business, in just your physical body will improve.
Right on. Awesome. Well, thanks so
Yeah.
much, Miss Anna, for joining us today.
My pleasure. It was very nice talking to you.